All right, Dr. Lynn and Dr. Steven, tell me how we know uh, that the Mexican clinics that you vet are up to par with American standards. Okay, do you just do this electronically and by phone calls, uh, or do you actually go down there and go through the clinic physically?
Excellent question, Gene, and I'm really glad that you've asked that. We go down and kick the tires. We go to the clinics, we interview the doctors who are doing the treatment, we examine their degrees, their training, any extra training, where they went to school, and we do everything we can to make sure that they are qualified, and we check the area for safety. Do you want to add to that, Steve?
Um, that's certainly essential to what we're doing, but the other part of our vetting process is that we look at all the aspects of their practice. We talk with the staff members, we find out how they're interacting with patients, we talk to them about how they handle financial arrangements, we ask them if they make any special arrangements to help people in terms of flying and accommodations once they're down there. So we are down there and we are personally looking at every aspect of their practice. We consider these practices, we hold them to the same high standards that we held our practices to when we were actually clinically practicing, and these are essential to.
So,
Good comment.
so when you're down there checking and vetting these outfits out, do you also check the equipment that they're using for?
Absolutely, we check the equipment, sterilization, and how they actually work with the equipment. And some of how we can check equipment is by seeing post-operative films and records, so that
Okay.
they show us that the work was done well.
And we also, let me just add, we also source the materials they're using. If they're placing dental implants, we check to see that they're using implants from reputable companies. Any type of other materials they're using for routine dentistry, we check the source of them to be sure that they're using materials that are basically American Dental Association approved.
And currently used, and those that others in the United States would use.
And we want to be able, we want to be able to assure the patient that when he comes back, he or she comes back to this country, that they can return to their local practice seamlessly, that there won't be any issues as far as what materials were used and the quality or the standards that, of the care that they receive, because we feel that's essential, that when they come back, they can resume and have normal follow-up care here with their local general dentist.
So, gentlemen, this sounds really interesting. So, when someone comes down and leaves their local dentist in the United States to go down to Mexico, um, there probably is going to be some concern about when they come back to their local dentist. All right, is there anything that Global Dental Healthcare can do to smooth that process over? Do you follow up with your patients, your clients, when they come back to the United States after a procedure?
You want to start with that one?
Sure. Well, first, it begins by talking with the general dentist prior to making any referral and getting all the records sent to us and establishing a conversation and a communication with their general dentist, letting them know that we are not interested in taking their patients away from them, but we're interested in having their patients get the best care possible. If it turns out that they can stay in their practice and afford it, that would be fine. If it turns out that they cannot, then we want the general dentist to be on board with us as much as possible, so that when they do return, the transition can be seamless and they're welcome back in the practice for regular maintenance care.
I think that was well said, but I'll also say that 1/3 of all people, adults in this country, don't see a dentist because of costs. So if we can help major treatment to get done at a less fee, the local dentist can make fees over the years as they maintain things and do smaller procedures or less expensive procedures.
So this is sounding like a win-win situation for everyone here. What are the drawbacks? Okay.
Again, an excellent question. Yeah, we want it to be win-win. Of course, we want all of life to be win-win. We want these patients good care. The drawbacks are we're all individuals who provide services. Steve and I have provided services over the years, and hopefully with an open, sort of not defensive attitude, but there are some people who are going to take offense and not follow up with their patients, and we will help them to find another dentist who will help them. They may lose their dentist is one of the drawbacks if they get real sort of defensive and not wanting to follow someone else's work, follow up on someone else's work.
Well, I would think that if a dentist didn't want the best interest of their patients, that it's high time for that patient to find another dentist.
Well, that's true, but the reality is that that can be a difficult transition for some of these individuals. As much as possible, we try to set things up before people leave and decide to go abroad so that when they come back, they would be welcome back. Again, that's our intention. We cannot have complete control over that, but every aspect of what we're doing in this business is based on being open and transparent and communicating with every individual who's involved, whether it's the patient, their general dentist, the dentist abroad, every individual. We are being totally open and transparent in what we are doing.
Okay, so let me just question one thing here. So you gentlemen will be consulting with the client patient, with the dentist before, during, and after the Mexico procedures?
Absolutely. We want to allay any concerns of the patient who needs the care, and we want to help them get there. And we will be present for before, during, and after.
Well, gentlemen, thank you very much. Yeah, you've given us a lot to think about, and this is pretty exciting. We'll stay tuned and follow us here for more interesting adventures with Global Dental Healthcare.